So good afternoon, my name's Dr Hume Rendle-Short and I'm a Toowoomba GP, and I'm happy to share some of the stuff that I've learnt over the years. And this afternoon I'd like to talk about a concept which has probably gained a bit of popularity recently, and that's the concept of deprescribing. So let me just explain what I mean by that word and how it fits into a clinical context. So the art of deprescribing is when we look at a patient who's on a various list of medication, whether that be 5, 10 or 20 medications, and we make a conscious decision that we're going to reduce that person's medication burden or medication load. In fact, we're going to stop medications. Basically, that's what it's about. It's about the art of how to stop medications in a safe and logical way. Now, the situation in which we consider this is, I guess, the two obvious situations in geriatrics, particularly in the nursing home environment. And let me say, nurses in the nursing home environment love it when we do it. They say, I like these doctors that over that first 6 months of the patient being in the nursing home cuts their medication by 50% or whatever. And the other situation is obviously in the palliative care situation. And I guess basically, I think it comes down to good clinical medicine and asking the fundamental question, why is this person on such and such, whatever that medication may be? Linked to that is, of course, the question of side effects and drug interactions, which makes it, the sometimes surprising result that the patient actually feels better when we deprescribe. But there's some classic medications. Why is somebody who's got a palliative illness on stuff like cholesterol-lowering medication, possibly blood pressure medication, etc. And so I guess basically the art of doing it is to think through the clinical situation, to think through why are they on these various medications, what's the time frame of these medication, and what medication can I safely stop, and then monitor that process. One last thought on it. I think fundamentally this is one of the roles of the GP. This is the art of being a good general practitioner, to be able to look at the patient's medication load and their treatment plan through the eyes of where is this person in their life, where is this person in their life's journey, and being their advocate, being their GP, being their main doctor, the pivot of the medical team, and being able to say, okay, it's time to stop such and such. And maybe it probably takes a few months to stop half a dozen medications. That's fine, as long as we work in that direction. Thank you.